Hello student, today we will discuss about classification of cancer. Classification made according to site of origin, grading means according to histopathology and cytology report, the grade is given 1 to 4 and staging based on extent of disease, the staging also 1 to 4, first stage, second stage, third and a fourth stage we will say no that. Okay, now let me see site of origin. Our body is made up by various type of tissue, epithelial tissue, muscle tissue, connective tissue and nervous tissue. From where this cancer cell begin, from which tissue it begins, according to that the name is given. The first one is a carcinoma. Carcinoma means what? The cancer cells originates in epithelial tissue. 80 to 90 percentage of all the cancers are most carcinoma. It mainly affect organs and glands. Glands means it is a tube-like structure which will produce secretion or a hormone. Especially the carcinoma will occur in a breast, lungs, colon, prostate and a bladder. So epithelial tissue, what is the main function of epithelial tissue? It cover entire body organ, especially skin as well as an internal organ. That's why 80 to 90% of the cancer is a carcinoma only. The subtype is a adenocarcinoma, occurs in a glands, means breast, lungs, colon, prostate, anyway. Squamous cancer occurs in a squamous epithelium cells. Okay. Okay, now next let me see sarcoma. Sarcoma means cancer cells originate in connective tissue. Such as connective tissue means what? The tissue which connect one organ to another. That is a bone, tendon, cartilage, fat, muscles. Osteosarcoma means cancer of the bone. Chondroma means cartilage. Leiomyoma means muscles. Means the cancer begins from the muscles. Liposarcoma means the cancer cell begin from the adipose tissue. So you can see in a picture here, okay? So you can have a look on the picture. Okay, next the third one is a myeloma. So what is myeloma? Myeloma means originates in a plasma cells of the bone marrow. Means the cancer cell begins from the plasma cells of the bone marrow. So what is a plasma cell? Plasma cell is a type of WBC, immune producing organ. So the cancer cell begins from the plasma cell. So you can see multiple myeloma. So you have come across many patients are suffering with a multiple myeloma. What is multiple myeloma? Has a many abnormal plasma cell, means many abnormal plasma cell will be present. Okay, the next one is a lymphoma. Originates in a lymph nodes. What is lymph nodes? Lymph nodes is a part of a immune system. Inside the lymph nodes, lymph gland, what is the fluid is there? So that will be flowing throughout the body and it provides immunity for us. So the cancer cell originate in a lymph nodes of the lymphatic system. Hodgkin's example is a Hodgkin's lymphoma, cancer of immune system. So you can see in a picture nicely. Okay, next we will move on. Leukemia. Leukemia is a cancer of white blood cell associated with overproduction immature WBC. Means the cancer cell, it start to begin from in a white blood cell. So it's called as a leukemia. There will be a countless immature WBC will be there. See, the normal WBC is a 4,000 to 11,000, but in leukemia it will be 1 lakh, 1.5 lakh or more than that. So you can see in a picture normal blood cells, the red color. So leukemia, how it will be, you can see here the immature WBC and the normal blood cell will be reduced, less in number. So you can see in a down picture also how it will be, the changes. When you have a look on a picture, no, you will come to know. Okay, now second is according to the grading, how it is classified. Means when a client come to the hospital, he is told to admit when doctor get doubt, and what they will do, they will remove a biopsy or any sample and they will send it for the histopathology or cytological examination. What doctors will do, under microscope, they will study each individual cells structure and function. So if they find any abnormality in the cells, like immature cells more or a mature cells, or it is very difficult to identify which is a mature or a immature. So based on that, they are given a grading, okay? The grading will be given 1 to 4. If less abnormality in the cell, 1 or a 2. If more means 3 to 4. So increasing abnormality, increasing grade. So these are you are studied under characteristic of normal cell as well as a abnormal cell. Abnormal cell means it is undifferentiated, highly abnormal, immature, and considered as a abnormal cell. Normal cell means it is well differentiated, closely resemble mature. Specialized cell means each cell is meant to do particular work and it does also. But in abnormal cell, no, it is not meant for to do any particular work. Without fulfilling any purpose, it is just going on multiplying. Okay, see grade 1. Grade 1 means cells slightly abnormal and well differentiated. Only few cells are abnormal, but majority all the cells are normal. So grade 1 means it is just started. It indicates the cancer is just started. Grade 2, cells are more abnormal, moderately differentiated. Quite difficult to differentiate which is a normal and a abnormal, but can do. Grade 3, cells are very abnormal and cannot be very poorly differentiated, which is a normal cell, which is an abnormal cell, which is a mature, which is a immature. Very difficult to identify. That is a grade 3. Grade 4, cells are immature and undifferentiated. Mean completely it is very difficult. Doctor cannot means which is a mature, which is a unmature, which is a normal, which is a abnormal. So that is a grade. Grade 3 and a grade 4 means already it is in a condition of severe condition. So you can pause the video and you can write down the notes. In a picture you can see grade 1, the normal cell well differentiated. Grade 2, little moderately differentiated. See, along between normal cell there are many abnormal cell, immature cells are present. In a grade 3 you can see it's a very difficult to differentiate which is a normal cell, which is an abnormal cell, mature cell or a immature cell. Okay, next staging. Staging means the cancer burden in the body, means how much it extended. The cancer cell, how much it extended in the body. Based on that, the staging is a given. So, TNM classification. Usually the doctors will follow TNM classification only. TNM means the T stand for tumor, N stand for node and M stand for metastasis. T represent tumor size, means size. If it is a small means the number will be given 1. If it is a very big means the number will be given a 4. N means a lymph node involvement. M means a distance metastasis, means a spread, how much it spread from one organ to another organ. See, tumor. Now, T stand for tumor. See, if you get the opportunity to work in a oncology ward, when you come across a patient, you go through the chart and see how the doctor has written. So, doctor usually mention this according to the TNM classification only. So, if you study here, when you go through the chart, now you will understand properly. So, the doctor will be using this method only. If the doctor is written in a chart, T0 means no evidence of tumor. TIS means carcinoma in situ. So what is the meaning of carcinoma in situ? Carcinoma in situ means abnormal cell found only in a place where they first formed. It is not started to transmit or a transfer. Okay, it is from where it begin. No, it is there only. So in such condition, immediately through the surgery can remove also. Now T1 to 4, increasing tumor size and involvement. So according to the increased size, the number is given. If the small tumor means T1. So you can see here. See, the tumor size is less than 2 centimeter. The doctor will write T1. Tumor sizes are 2 to 5 centimeter, T2. Tumor sizes are more than 5 centimeter, T3. If the tumor size is more than 5 centimeter and extended to skin and chest, all the body organs, then it is a T4. Very important, university important. They will ask 5 or 10 marks. Now N, node, lymph node involvement. Along with the now tumor assessment is over. Now next the doctor will write about node, whether a lymph node is involved. If doctor write N0, okay, that N0 means No lymph node involvement means lymph node, it is not started to spread to a lymph. N1 to 3, increasing degree of a lymph node involvement. Means N1 to 3 means the number is given, okay, it's based upon how much it extended, 1, 2, 3 number will be given. If doctor write NX means lymph node involvement cannot be assessed, means almost all the lymph nodes are involved, so it is difficult to assess. In such condition, it means the already the client is in a third or a fourth stage, it indicates. Now metastasis, M stand for metastasis. Metastasis means a spreading, means full. M0 means no evidence of distance metastasis, means it is not spread to any body organs. Where it started, it's there only. M1 means evidence of distance metastasis, means already it has come out from its pouch and it started to spread to entire body organ. So, hope student you understood classification of cancer. It's very important. Either 5 or a 10 marks they will ask. So, you have to explain where it is a needed explanation. So, the major part, the last part is a treatment modality. So, that treatment modality I will explain in a next video. So, till there, bye-bye. Take care. In a part 4, I will explain. Okay. So, you can pause the video and you can write down the notes. Okay. Thank you.